What's up, everybody? Welcome back to the PT on Ice Daily Show. Before we jump in, let's dive in a bit and talk about Jane, how you can leverage their platform for your business. If you're new to the name, Jane is a practice management software that wants to help you grow and manage your practice. We've noticed especially just how helpful Jane's one-on-one telehealth feature is in a world where telehealth is becoming more and more the norm in part of PT practices nationwide. It's included in all of Jane's subscriptions at no extra cost, meaning there's no need to integrate with a third-party telehealth service. No extra fees, no copying and pasting links or URLs to client emails. Everything is automated directly through Jane to save you and your clients time. Using one-on-one telehealth with Jane also means you can continue offering to help your clients who may not be able to reach your practice or simply want to leverage the online option. Learn more about Jane's telehealth feature at jane.app/physicaltherapy. Their team would love to meet you and help you get started. You can use the promo code ICEPT1MO at the time of sign up for a 1-month grace period. Thanks, everybody, and enjoy today's show.
Hey, good morning. Happy Friday, everyone. Welcome to another edition of the PT on Ice Daily Show. It's Fitness Athlete Friday. My name is Jason London. I am lead faculty with the Endurance Athlete Division. And so, we jump on here about once a month, once every 6 weeks or so. So we're up again. And what I want to talk about today is the importance of running analysis for the postoperative knee patient. Before I jump into that, first, sorry to anyone who's trying to watch live on YouTube. I am getting the spinning circle of death, so we'll get it up there after we get this done and posted on Instagram. So also a couple upcoming courses. For the Endurance Athlete Division, we're just wrapping up our first Rehabilitation of the Injured Runner online cohort this next week for 2022, and the second cohort will be starting March 15th. So if you want to jump onto that, there are some seats available for that. For Rehabilitation of the Injured Runner Live, unfortunately our Bellingham course this March is full. So the next opportunity to check us out, I believe, is in Fenton, Michigan in May, home to Alan and Mitch. So come join us there. Definitely going to be a great time and probably some awesome learning going on as well. Bike Fit, next Bike Fit course will be in Minneapolis, also in May. That one's filling up, so if you're thinking or on the fence on that, grab a seat soon before we fill that up. And then finally, Sampler is going to be in April. Megan will be presenting from the Endurance Athlete Division there, but if you haven't been to Sampler, please come check it out. It's awesome, and all of the ICE faculty are there. So great time, and there are seats available for that. So what I want to talk about today is the importance of running analysis for the postoperative knee patient. A study came out last summer, the American Journal of Sports Medicine, by Nur and colleagues out of Brian Heiderscheid's lab in University of Wisconsin. And what they looked at is they did running gait analysis on all their D1 athletes that have running as part of their sport or as part of the training for the sport. And then this allowed them to prospectively look at how changes, if changes in gait occur, running gait occur after knee surgery. So they had all this data prior to these athletes getting injured, and then a year out following ACL reconstruction, they looked at the athletes' running gait again. So a year out, that means that the athletes should be back to full participation in sport and be done with the rehab. And interestingly, what they found is that there are differences in running gait mechanics before and then after surgery, as well as between post-surgical patients and healthy controls. So also looking at athletes that did not have knee surgery. And what they found is the changes in gait mechanics that you're going to see are in the sagittal plane, so from the side view, and it really has to do with loading through the knee. So those patients that had, or athletes that had surgery and are a year out, still exhibit decreased loading through that operative leg. So they had decreased knee flexion at mid-stance on the operative leg compared to the non-operative leg. And this was not observed prior to them having surgery or in another set of athletes who were at the same time and did not have surgery. And they found the difference that was significant was anything more than 2 degrees. So pretty slight, and generally it was larger than that. But again, decreased loading through that postoperative knee on that side. So asymmetrical gait pattern. So why is this important? Well, I think I can think of two reasons why it's important. First and foremost would be performance, and that's what most of our patients are going to be worried about right away, especially these in this population that was studied, D1 athletes. And unfortunately, when we look at injuries requiring knee surgery, ACL reconstructions are one of the top injuries requiring knee surgery, and that can be debated, of course. But a lot of knee surgeries are because of ACL reconstructions. And unfortunately, that surgery has the lowest return to sport than pretty much any other common knee surgery. So we need to be getting our patients functioning as best we can. So if they're having an asymmetrical gait pattern, that potentially could be a reason why they're not getting back to the level that they need to for their sport. And secondly, and more important probably in our mind, is long-term morbidity for those patients. And when we're talking about morbidity, that's talking about long-term complications and decreased quality of life for those patients following knee surgery. And unfortunately, once a patient has knee surgery, their risk of early onset arthritis to either the tibiofemoral joint or the patellofemoral joint increases significantly. And we still don't know exactly why that is. It could just be due to the trauma of the initial injury plus the trauma of the surgery, or it could be due to some modifiable risk factors, things that we can change and that haven't been modified appropriately. So strength and then proper mechanics. And so I'm going to take a leap here and say that if our athlete doesn't have proper mechanics, and typically they're not going to have the proper strength to have the proper mechanics, so these go hand in hand, that's going to set them up for increased risk of developing early onset knee OA. And I have some research to support that, looking at walking gait, again looking at patients following ACL reconstruction. At 3 months, patients will exhibit differences, again, in loading that operative limb compared to the non-operative limb with walking gait. And then this has been seen up to 5 years following. That's probably the farthest out it's been studied, where patients are still, just in walking gait, are not loading that operative limb the same as they're loading the non-operative limb. And some really cool studies have come out lately where they're using MRI imaging and looking at the relaxation times for the cartilage and seeing some differences between the operative limb and the non-operative limb and how that limb is loaded that kind of predict, in a way, knee OA. And so that underloading of the limb seems to be an important factor in the development of early onset knee OA. So we're seeing that in walking gait, and then with this nurse study that came out last year, we're seeing this in running gait as well. And so it's really important to, again, get the gait analysis, get the camera out, because it's really hard to see these things, especially a 2-degree difference, or a little bit greater than a 2-degree difference in real time. So we need a video camera, so ideally capturing at greater than 120 frames per second, which if you're using an iPhone or a tablet in the slow-mo version, that's going to be 120 frames per second or greater. But just make sure you're capturing quality video, with the setup, making sure you're perpendicular to the plane of interest. And this plane of interest that we're really interested in with our postoperative knee patients is, again, the side view from the sagittal plane. So be same distance out from the left side and then same distance out from the right side. and then looking at stopping and pausing the video at mid-stance and looking about the amount of knee flexion at mid-stance from the operative side compared to the non-operative side. And if you see greater than a 2-degree difference, so probably needing to use gait analysis software where you can draw in some joint angles, if you're seeing greater than a 2-degree difference, you need to intervene with some gait retraining. And another telltale sign is if you're having trouble deciding 2 degrees, which it can definitely be difficult, look at a landmark on the patient at mid-stance, typically the waistline, and see how high that is compared to some stationary object, usually the arm of the treadmill, on the operative side compared to the non-operative side. And if they're not flexing their knee the same amount on that operative side, you're typically going to see that waistline be higher on the treadmill arm compared to the other side. So another quick way to look at that. So again, seeing a difference in loading on the operative side compared to the non-operative side, we need to intervene with some gait retraining. We definitely probably need to intervene with some continued strengthening, particularly quadriceps eccentric strength. But strengthening alone has been shown over and over again not to necessarily result in changes in gait mechanics. We need to have that intervention of gait retraining as well if we want to see changes with that. Otherwise, the athlete may get stronger, but they'll just keep those compensatory patterns that have become ingrained at this point by the time that they're getting back into running. And so for gait retraining, we're going to actually do the opposite of what we do for most running-related injuries. We want to increase load, and we want to probably increase the rate of load as well. So we can do cadence manipulation, but we would do the opposite of what we do for most running-related injuries, where we're trying to prevent overstriding and trying to prevent excessive loading. With those individuals, we're increasing their cadence. But with these post-operative patients that are underloading, we're going to decrease their cadence by 10%. That can be one cue. Another cue that I typically use most often is just a verbal cue. If I want you to keep running, I want you to think about sinking into your knee or sinking into your step every time you're running. That one works really well for me. Or another one is I want you to hit the ground harder, and particularly having them hit the ground harder on that operative leg. So, and that is where I've seen anecdotally through working with my patients faster changes with their gait mechanics, but this still takes time. I'm telling you, so most of the athletes that I'm working with for return to run, we're starting that at 3 months at the very earliest, but typically at the 6-month mark, based on the biology of the surgery and the healing of the repair or the reconstruction. So typically 16 weeks is when we're starting that, or 4 months, starting a return to run program. I'm not typically seeing normalization of their gait until 9 months at the very earliest, but typically 10 to 12 months. So we're still working with those patients, even though they may be cleared for return to sport, to continue to work on their gait mechanics if we're seeing it. So take home message from today: need to look at running gait with a camera in our postoperative knee patients when they're returning to run. Look at it from the side view, and you're looking for the amount of knee flexion at mid-stance. Operative side compared to non-operative side. So this is a situation where you definitely want to get video from each side, and ideally have those cameras the same distance from the treadmill, so you're comparing it, so it's much easier to compare side to side. If you're seeing more than a 2-degree difference in knee flexion, so limited knee flexion in that operative side, you need to intervene with, ideally, with probably some increased quadriceps work and strengthening, and maybe some hamstring work, but also needing to intervene with gait retraining to increase load. So decreasing cadence, having them sink into their step, or hit the ground harder. And continue to work with them until you see that normalize. And this, in my mind, is going to help increase performance for those athletes and decrease or mitigate the risk of early onset knee OA for those athletes. So that NURR, K-N-U-R-R article is a great read. American Journal of Sports Medicine, July 2021. I'll try to get that posted on our Facebook page later today. And that's it. That's what I got for you today. So I know some of you may not work with a lot of postoperative patients acutely, but I think all of us in outpatient PT, regardless of the setting that we're in, we're going to have those patients that have had a history of knee surgery. And so I think it's important, particularly if they're having running-related injury or running-related pain, to look at their gait with that and compare again side to side and see if they're still underloading that limb. All right, everyone, thanks. Have a great Friday. Have a great weekend. Get out, enjoy the outdoors with friends and family, and I will probably see you at least down here in a little bit greater than a month or so. Also, for those of you that will be entering comments below, I am traveling for some ski races this weekend, so I won't have great access to internet. I will, when I get back on Monday, take a look for comments and answer those. Or otherwise, best thing for me is either message me through Instagram, the Endurance PT, or even easier for me is email Jason, Jason, at excel, E-X-C-E-L, PTMT.com. Have a great one.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.